Hey everyone, welcome to the Happy Flosser podcast. My name is Billy Lunt. I am your host, and I'm here to talk to you about all things dental hygiene to support you on your journey through the dental hygiene program. I am so happy to be with you today. And today we're going to talk about a topic that every student really needs to master, and that is toothpaste ingredients and fluoride. I think sometimes we overlook this because toothpaste seems so simple, right? You grab a tube, you brush your teeth, you spit it out. But as clinicians, we really need to understand what's actually inside these products, how those ingredients work, and when to recommend them to our patients. And honestly, most importantly, we need to understand the different types of fluoride, how they behave chemically in the mouth, and when each one is appropriate to recommend to our patients. We are the experts, right, in this area. And we want to make sure, I mean, marketing is great, but we want to make sure that everything we're doing is based on the evidence and the science of what we know. So let's break it down in a way that's really clear, easy to understand, and really clinically useful for you. There are a lot of questions on your board exams that kind of target to see if you understand what I'm about to share with you. So different patients have different needs. And although our patients can go to the store and purchase whatever they want, it's really important for us to make sure that when we are recommending a specific toothpaste to our patient, we're doing it because of the evidence of what we know is in that toothpaste that is going to help our patient. So let's start with the big picture. Toothpaste isn't just some minty gel. It's a delivery system. It's a vehicle, right? So just like an English muffin is a vehicle for me to eat peanut butter, right? But which English muffin I choose is very important to me. So not to make light of it, but really it's important for us to understand the active ingredients that prevent disease, reduce sensitivity, control biofilm, and really support the remineralization process. Those are the things that we're looking for, right? We want to know, well, because there's a lot of things that you can put in toothpaste. You want to make sure that what you put in there is accomplishing those specific goals. Are we preventing disease? Are we reducing sensitivity? Are we controlling biofilm? And are we supporting remineralization? And are those the things that our specific patients needs? So when you understand the ingredients of what's in the toothpaste, it helps you to be able to make informed decisions, evidence-based recommendations to the specific patient you're speaking to, and really tailor those product recommendations to the needs of your specific patient. What's even more important is you'll be able to explain the why behind your choice to each patient that you serve. This goes a long way. When you say to a patient, I recommend this toothpaste because it has this product and this is what it will help you with. And you can confidently say that because of what I'm going to tell you and what your knowledge is. So you have an understanding of all of the ingredients. That goes a long way of building trust and better compliance from your patient, right? So not only is this helping to prepare you for boards and clinical practice, this is helping you to make confident recommendations to your patients that are actually going to support their help and help them, and it's going to support the process of improving their overall health. Honestly, patients don't really care about brand names. They care about results, and they do care about taste. Results come from ingredients, and we know this. So it's important to make sure that it tastes good to that patient because then there's a compliance thing. But when they trust you and they know that you are giving them information based on their specific needs, it really goes a long way at helping them stay the course and stay dedicated to it. So let's talk about the core ingredients of toothpaste. So you have abrasives in there. And the purpose of abrasives is to remove the stain and disrupt the biofilm. And some of those abrasives could be things like dicalcium phosphate, silica, or calcium carbonate. And remember, they have an RDA value. So avoid high abrasive paste for things like recession or sensitivity or erosion for our patients. Because if you look at the different toothpaste, they have different variabilities on the amount of abrasivity that they have. The second ingredient is humectants. And the purpose of humectants is to keep the toothpaste from drying out, right? So you have something like glycerin or sorbitol. There's no clinical activity that is performed by these ingredients, but they're essential for things like texture, which is also very important to our patients to understand, because they want to know. And you know what? Patients don't even really think about this. They don't articulate this, but it's just a thing. It's almost like sushi. When you eat sushi, if you're not a sushi lover, you don't get this, but that's okay. When you eat sushi, texture is everything. When you put toothpaste in your mouth, texture is also very important. So take a look and see what's some of the humectants offered. So if a patient doesn't like a specific toothpaste, it may be something as simple as whether it has sorbitol or glycerin in it and what the texture is for that patient. So you can try to look for like a bucket of toothpaste examples to provide that patient if there's one that they don't care for. The next ingredient that is in a toothpaste is a detergent, right? A surfactant. So that is actually what creates the foam or helps spread the active ingredients around. So sodium lauryl sulfate is probably the number one ingredient used for that. It's important for you to know as a clinician, some patients are really adamant that they use things that do not contain sodium lauryl sulfate because it can irritate tissue in some patients. Um, and also patients, and this is just my own personal experience, a patient who has recurrent aphthous ulcers may be sensitive to sodium lauryl sulfate. So good to find alternatives to that. And you will notice that texture matters, like I said, but if you have a toothpaste that has less sodium lauryl sulfate in it or no sodium lauryl sulfate, it will not foam up and make all those bubbles that some patients just have grown to love and connect with having their teeth nice and clean. So it is a little transition period. So sometimes just informing your patient about that sensory issue. The other thing that you'll find in toothpaste, if you're really looking at the ingredients list, is a binder or a thickener, right? So it's not like mouthwash, right? So it stabilizes the formula. And some of the ingredients that do this are like xanthan gum or carrageenan. And those two things tend to just make it a little thicker so that it actually sticks and comes out of the tube the way that it does, the way we're familiar with toothpaste. And that just makes it so that it's not as messy. And although, if you have children, toothpaste is really messy. I can't imagine what it would be like if there were no binders or thickeners in it when my kids use the bathroom to brush their teeth. It's a little messy. And then we have flavoring agents and sweeteners, and this is really for taste because we know that if something doesn't taste good, the patients are really going to be reluctant to continue staying committed to that type of toothpaste. So these are things like saccharin or xylitol. Xylitol's had a big, real, influence on toothpaste because it has the anti-carcinogenic benefits of it. So it's really great for high caries risk patients. So you get that double benefit. Not only is it making the toothpaste taste better, but it's actually helping with the high caries risk because our pathogens are not able to properly digest that sweetener. So then you have the active ingredients. So those are all the things that kind of make it so that the active ingredients can do what they need to do, right? So this is where the magic happens. You've got your fluoride, your desensitizers, your anti-calculus agents, your whitening agents, and your antimicrobials. And fluoride is the star of the show. Okay, so all of those active ingredients, and those are the things that you need to be really proficient in as a clinician. So let's just kind of talk about each one of these and the benefits of them so that you can really understand the different fluoride types. And we're going to start with sodium fluoride, right? NaF. Starting with sodium fluoride, let's talk about what it does. It provides a free fluoride ion very quickly. And what does that do? It enhances the remineralization process because it forms fluorapatite, making the enamel more resistant to acid. And you're going to see this in most standard toothpaste. You have varnish where you use sodium fluoride. They sell gels, and there's also rinses. All of these are adequate mechanisms of getting sodium fluoride to your patient. And some of the pros of using sodium fluoride is that it's very stable, it's very effective, and it works really well in a low pH environment. So there's no specific contraindications, but you want to avoid swallowing it, especially in children, right? And its shining star best use is for general caries prevention, patients with a moderate risk, and really everyday use can be for sodium fluoride. When you get to stannous fluoride, the mechanism for stannous fluoride, and that's SNF2 for all you chemistry lovers, that provides fluoride ions for remineralization. It also has antimicrobial action due to the stannous ion, right? The tin. It reduces gingivitis and it really helps with sensitivity because it occludes those tubules. And where do we see stannous fluoride? Crespro Health, lots of prescription paste that we have. And what's so great about stannous fluoride it is that it provides a broad spectrum benefit of caries, gingivitis, and sensitivity, right? So it's great for our high risk patients and it kind of covers all the bases. So if you have someone that's just dealing with all the things, then you're going to reach for your stannous fluoride containing toothpaste. Here's the problem with stannous fluoride. It can cause extrinsic stain and the taste can be metallic. So those patients who are really sensitive to taste, um, they will pick up on that stannous fluoride. The other thing is that it does require stabilization in order to prevent oxidation from occurring. And that's, all the chemistry nerds out there understand what I'm talking about. But what's important for you as a student is to really know that it's great for patients with gingivitis. It's great for patients with sensitivity. It's great for our high risk caries patients. And it's great for those patients that have that multi need, right? So you can just prescribe that one thing to them and confidently give them that. So the way that I tell students to remember that the stannous fluoride stains, stannous stains, that's easy to remember. But the why we still use it, even though it stains, because nobody wants stain on their teeth. We use it because even though it stains, it's a superpower fluoride because it does all the things, right? So it's really a great toothpaste. And the fact that I know there's a lot of scientists out there that took a long time to stabilize stannous fluoride in a toothpaste to make it so that that benefit could be utilized by patients. So even though it stains, it's a super fluoride. And so this is why we recommend it and use it. And then we have our MFP, our sodium monofluorophosphate. So that fluoride, it's bound to the phosphate. So what happens is it actually requires an enzymatic activation to occur in the saliva, which takes a little bit of time to happen when our patients start brushing their teeth. So it has a slower release of those fluoride ions. And you're going to see this in some of the Colgate products and many of the over-the-counter toothpastes. So you'll see that long word, and then in parentheses, usually you'll see MFP so that it's easier to recognize. So the pros of this particular fluoride is that it's really stable if you have calcium available, and it's really good for patients who are using calcium-based abrasives. What's hard is that slightly less bioavailability when you compare it to something like sodium fluoride because of that activation that has to happen to release the fluoride ion. So it's really great with patients who have a mild to moderate caries risk, and it's great for everyday use. The only drawback is that you have to brush for a certain length of time before the fluoride is even available so that it can be taken in and create fluoroappetite. So those are kind of like the main fluorides without getting into the details of like some of the prescription pastes. But I really just wanted to stick with the over the counters and like what's in those toothpaste. So when do we recommend each of those fluorides? So for high caries risk, we're going to go for the stannous fluoride or 5,000 part per million sodium fluoride. We're going to go for something with xylitol, something that has xylitol in it because we know what that does to the pathogens that actually cause the high risk caries. We're going to look for neutral pH formulas, and we're going to avoid things like whitening paste that actually increase the sensitivity. For patients who have gingivitis, we're going to look for those stannous fluorides for that antimicrobial benefit, And we're considering the sodium lauryl sulfate, right? We want to make sure that if the tissue is irritated, maybe we're looking for something that doesn't contain as much of the sodium lauryl sulfate because that might be a partial contributor to that tissue irritation. When our patient has sensitivity, we're going to look for those stannous fluoride containing products because of the tubule occlusion. We're going to look for the potassium nitrate. Ooh, there's another new word, right? Because what that does is it depolarizes the nerve. And then we're going to look for those calcium carbonate formulas because when we know there's sensitivity present, everybody has a different level of sensitivity, and then what works for them can be completely different. So it's important for you to do your research and see the mechanism of action for each of those sensitivity products, and then try to connect the dots to see which one is going to actually do the best and move the needle for your patient. When your patient has something like erosion or recession, you want to make sure you're looking for that lower abrasive paste. And you're going to stick with the sodium fluoride or the stannous fluoride. Avoid things that contain like charcoal or high abrasive whitening paste because that is actually going to be a contributing factor to those softer regions. And then for ortho patients, you need a high fluoride prescription paste sometimes when they have a high caries risk, or you're going to rely on that stannous fluoride for that gingival inflammation and really put some emphasis on the remineralization process so that you can combat all of that equipment and appliance that's in the mouth. And honestly, I think it's important for you to consider how you explain fluoride to your patients. Patients don't need a chemistry lesson when they're sitting in the chair. They really need clarity. And what's really challenging about the fluoride conversation is that there's a lot of conflicting information out there. So it's important for you to do the research, have a solid understanding yourself of the benefits of fluoride, have a solid understanding of the argument against fluoride, and have some alternatives available for yourself. And I know I have several episodes that cover some of the alternatives to fluoride on my podcast, so you can scroll through and look for those. But having a script so that you can really speak to the concerns and the benefits. So something like fluoride helps your teeth repair themselves. Every day, acid weakens your enamel, and fluoride helps rebuild it to be stronger. Different types of fluoride work in slightly different ways. So I would recommend the fluoride that best meets your needs specifically. So that's just like a little way to explain to your patient why you're recommending the specific fluoride that you're recommending. And then you can go on to say the science behind the specific fluoride attached to the assessment outcomes of your patient. So just a just a little advice for you on how to have that conversation with your patient. So just a couple of memory tips to help you so that when you're getting ready for your board exams or you're getting ready for your tests, that you can kind of quickly remember these different ingredients. So sodium fluoride is neutral and fast, right? It's stable with a quick ion release. Stannous fluoride, it stains, but it's strong and versatile. So it's antimicrobial and sensitivity. MFP, it must free the phosphate, so it needs activation before that fluoride is released. And then the 5,000 parts per million is high risk only, so that's a prescription strength level fluoride. So guys, understanding toothpaste ingredients, especially fluoride, is one of the most practical skills you can use as a dental hygienist. It really shapes your recommendations, your patient education, and really your clinical decision making. So the more you understand the why, the more confident you'll feel in clinic and on your board exams. If you found this episode helpful, please share it with a classmate who's studying for midterms or board exams. And always, always, always reach out if you need to. Keep learning, keep growing, and keep flossing, guys. I'll see you in the next episode. Have a great week.